Hi, I'm Dr. Rita Schatz, your vagina whisperer. I work at New Look, New Life. I'm here to talk about revision of episiotomy. During childbirth, at the time when a woman is pushing, a beautiful baby head is coming out. In anticipation of that head, we often do an episiotomy. It is a cut between the vagina and the rectum in a space called perineum, often midline or to the side. That repair afterwards is done with suturing while a woman just delivered a baby, after the placenta came out, after an hour or more of pushing while the tissue is very, very swollen. And when the repair is done, although everything looks together, the aftermath is quite crucial. The repair may not be as beautiful, may not be as functional. Often women have pain, scar tissue, intercourse is affected, exercise is affected, and most important, their confidence is affected. I'm here to repair, restore, remove the scar tissue, give them the confidence, have them enjoy their sex life as prior. I often encourage women who have the episiotomy revision to be done with childbearing, at least vaginal childbearing. They could still have a baby, but I encourage to have a cesarean and not touch the vagina and perineum, meaning not have a vaginal delivery at that time. I need 6 to 8 weeks recovery time, nothing per vagina, no intercourse, no exercises, no tampons, no tub bathing, and no heavy lifting for about 6 to 8 weeks. Complications can include bleeding and infection. We often give women antibiotics prophylactically to avoid it. And looking forward to seeing you guys. If you want information, please follow us for more.